So the question again is, what's the difference between binge eating disorder, food addiction, and emotional eating? I want to illustrate some of these differences by telling you about previous patients of mine. And let's start with Melinda, who's was a former patient who says, I eat, and I know that I should stop, but I just can't. I eat so much that I want to throw up and my stomach hurts and I have to lie down. Sometimes I feel like if I don't eat everything I can get my hands on, I'll just explode. Well, her words highlight the anguish that many people feel when food controls their lives. So Melinda often felt really powerless and out of control around food. And she also felt hopeless that her behavior could change. Her struggle with food is an example of what we're going to talk about binge eating disorder, because that was her diagnosis. So let's start with some definitions and information about binge eating disorder. Well, first of all, up to 25% of people living in larger bodies who seek weight loss programs have actually have binge eating disorder. And unlike other eating disorders, binge eating disorder appears to be almost as common in men as in women. So that's unusual because for bulimia and anorexia, for example, it's overwhelmingly women who struggle with that disorder. But for binge eating disorder, it's almost as common in men as in women. And it also affects African Americans as often as Caucasians. Now, if you have periods in which you eat large quantities of food, more than what most people would eat, in one sitting, you may have binge eating disorder. Now, other symptoms include difficulty in controlling how much you eat and feeling powerless to stop eating, even though you may no longer be hungry, or you may feel stuffed. Now, this isn't just at Thanksgiving. I think all of us often have a little binge eating at Thanksgiving or other holidays, but this is something that would occur on a regular basis, not specifically related to a holiday. After a binge, you may suffer from emotions of disgust and shame and embarrassment about how much you're eating. You may eat in isolation because of embarrassment about how much you've eaten. For individuals who struggle with binge eating disorder, these behaviors around food and also body dissatisfaction often began earlier than for other people. So they may have a history of dieting at a young age. I mean, I've had patients who've been put on diets at 5 years of age, which is unbelievable. And many times they're told by the pediatrician, your child needs to be on a diet. So they put them on a diet. The people I've seen are obsessed with body shape and size. And, they have similar thought patterns about their body as do people with bulimia. So individuals living in larger bodies is part of what makes it the criteria for binge eating disorder, but not everyone who has binge eating disorder is living in a larger body. So we cannot judge it by the size or weight of a person. It's more determined by the behaviors. A hallmark of binge eating disorder is, interestingly, a history of exposure to negative messages about shape, eating, and weight. Now, while dieting may be associated with binge eating disorder, in many people, binging behavior actually begins before dieting. But we do know that dieting will make binge eating disorder worse. Now, binge eating disorder is 3 times more common than anorexia and bulimia combined. And it's the most common eating disorder in the United States. In both, and as I said, it occurs in both men and women almost equally. And it's the most common eating disorder in adults in the United States. So you may be surprised by the statistic that it's more common than anorexia and bulimia combined, because we hear so much talk about those two eating disorders, And when you say eating disorders, in fact, most people think about anorexia and bulimia. They don't think about binge eating disorder, but binge eating disorder is much, much more common. So now let's talk a little bit about food addiction. And here's another patient who I've seen in the past. Her name was Jen. And when we discussed her relationship with food, Jen became very animated. She was a self-described food addict, and she talked about how her heart rate would increase and her mouth would water when she was even in the car on the way to the grocery store, and particularly when she would walk down the chip aisle of the grocery store. She talked about trying to avoid even going shopping because she knew she wouldn't be able to resist buying this large bag of chips that she described as her downfall. But she also described her anticipation of getting the chips and said it was a feeling like what she thought a drug addict would feel when they were going to score crack cocaine. She felt like a kid in a candy store, guilt-free and excited about her purchase. And she sometimes felt the need to explain to the cashier why the bag was already open before she had even paid for it. And she would say things like, "Oh, I missed lunch today, so I am starving." She would make promises to herself and then bargains with herself to keep herself from buying the chips. Or if she gave in to her cravings, she would promise herself she would eat just half the bag and then put them away. So she also came up with punishments that she would give herself if she slipped. And so her eating felt completely out of control. So how do you know if Jen had food addiction or if you have food addiction? Well, there are no medical criteria for food addiction at this point. However, there's a series of studies that have been done using the Yale Food Addiction Scale with a proposed list of criteria. And these are the same criteria that have been used to identify people with substance use disorders. So the Yale Food Addiction Scale has found that 5 to 10% of the general population test positive on that Yale Food Addiction Scale, including 7% of children who were tested. The Yale Food Addiction Scale also shows that food addiction is 15 to 25% higher in those living in larger bodies compared to those of normal weight by BMI. Even higher rates of food addiction are found in those who are seeking weight loss surgery or bariatric surgery, or in those who are living in larger bodies and also have binge eating disorder. That incidence is 30 to 50%. So binge eating disorder does share a number of characteristics with food addiction. There is overlap. 57% of people diagnosed with BED also meet criteria for food addiction. And in both disorders, people experience just an extreme lack of control over their eating and continued eating despite having negative consequences. Also, the inability to change their behaviors, even though they really want to. Though there is that overlap between binge eating disorder and food addiction, there are also differences. People with food addiction tend to experience even higher levels of poor self-esteem, depression, and difficulty regulating their emotions. So one of the markers in the research on food addiction is that 100% of those taking the test report the desire to cut back or stop their eating behaviors. So if you have food addiction, you're likely to have more intense and frequent food cravings than someone without food addiction. And when people who have food addiction see what we call highly palatable foods, or you can just call them comfort foods, their brains light up on scans in a way that's different than those people without food addiction. And this pattern is similar to the brain scans of people using drugs of abuse, but also doing any pleasurable activity, whether it be hugging your child, watching a sunset, having a good dinner, etc. But if you have food addiction, you can You may also be more likely to engage in emotional eating, which we're going to talk about in just a moment. So that's food addiction. So we've talked about binge eating disorder. That's eating a large quantity of food in one sitting, eating in isolation because of embarrassment and feelings of emotional distress, disgust, regret about how much you've eaten. Food addiction, we've mentioned, has some overlap with binge eating disorder, but also people with food addiction tend to have more intense food cravings, and have more extreme levels of feeling out of control and feeling emotional distress related to their eating. So let's talk now about emotional eating. Emotional eating can be defined as eating in response to emotional cues or eating to make yourself feel better or change your mood, as opposed to eating in response to being physically hungry. So here's one of my patients who has emotional eating disorder. Marianne just turned 60. She's married and has a successful career in nursing. Although she feels good about most things in her life, she continues to struggle with food and body image issues. When she's happy, she overeats. When she's sad or angry, she overeats. When her husband has to work late and she's home alone, she overeats. She describes food as my best friend. Even though she has read many diet books and has been on numerous fad diets, she can't seem to stop herself from having a few more cookies. A few always leads to half a bag or the whole bag. Then the guilt comes and she feels ashamed at having so little control. She really believes that if her life was less stressful, she could stop overeating. Or if her husband were more affectionate, she wouldn't turn to food for comfort. So if you're like many people with food and body image issues, you may be able to recognize that your emotions at times can feel overwhelming. And that is even if the emotion is quote unquote a positive emotion, like feeling happy or having something to celebrate. It doesn't always have to be a negative emotion, but some people with emotional eating feel just flooded by any emotion, and they then tend to either completely shut down, or they may have real trouble even naming what they're feeling, naming the emotion. So both reactions to emotions are really flip sides of the same coin. When you're stuck in what I call the emotional soup, you may feel that your emotions are in charge. They're in the driver's seat, and you're in the back seat trying to reach forward and drive the car. So emerging from the emotional soup requires emotional development, and that is being able to identify, express, be aware of, and regulate your emotions. Because it's not your emotions. In other words, it's not having an emotion that causes the problem. It's really your inability to manage those emotions, or it's your attempts to avoid emotions altogether. But when emotions are not acknowledged, they find expression in the foods that you eat, and also in the size and shape of your body, and in the need to eat foods that may be soothing for 5 minutes, but don't quench the underlying root cause of your emotional eating. So emotional regulation really means being able to learn the skills to be able to cope with your emotions without always defaulting to food. So learning to identify your emotions, put a name on it. They say in the 12-step programs, name it and claim it, is the first step to being able to learn to regulate your emotions in a healthy and safe way. And that's important because it allows you to be the individual you are with your own perceptions and viewpoints. Emotional expression is a necessary part of what it means to be human. So let's summarize. There is overlap between binge eating disorder, emotional eating, food addiction. For example, you may have food addiction, and one of the behaviors you use is binging. Or you may have binge eating disorder, and any emotions may trigger a binge. So studies also show that dieting makes all of these disorders worse. So dieting isn't the solution. It actually is, it can be a cause of the problem. The problem is also not with food. So it's not food that's the problem. It's how you are using the food. In general, food addiction causes more emotional distress, and people are more obsessed about food than for those with binge eating disorder or emotional eating. But for all three, food is used to numb emotions, to tamp down uncomfortable, even positive emotions, or to get back feeling in control when you're experiencing negative emotions. For many people with binge eating disorder, emotional eating, and food addiction, there is underlying childhood adversity or trauma or neglect that was the beginning of them starting to use food in the way that they do. Also, for most, there are associated body image issues, and sometimes there can be depression and anxiety. Well, does it matter what the label is? Well, binge eating disorder is the only one of these disorders that is listed in the Diagnostic and Statistical Manual of Mental Disorders, and therefore the only one that may have some coverage under insurance. But beyond insurance coverage, I think the labels can help you have a better understanding of what's going on with you and your relationship with food and your body. And it also helps you get a name to what you've been feeling. This can make you feel like you're not alone and offer you some sense of that what you're experiencing is real. It's not something you've made up. So I think that's one of the reasons why the label is helpful. But the bottom line is, if you're struggling, if you've been struggling for all your life, or even just recently with binge eating disorder, food addiction, and emotional eating, there is help and support available. As you know, I've written a book on each of these topics, and I also run the Anchor program that is a non-diet approach to treating binge eating disorder, emotional eating, and food addiction. The Anchor program, we have one beginning very soon. So if you're interested, please sign up for the free consult to see if you'd be a fit for the program. And the link will be in the show notes. Also, I want to just remind you that I am offering a free copy of my book, the Food Addiction Recovery Workbook. You can get a free copy. You pay for the postage. I'll pay for the book. And for our international listeners, we're now able to offer a free copy of the ebook for the Food Addiction Recovery Workbook. So that just look in the show notes and you'll see all the information you need to either find out about the Anchor program and sign up for your free consult, or get a free copy of the Food Addiction Recovery Workbook. Okay, the next podcast we will be talking about healing from using the 5 levels of recovery. And that's healing from binge eating disorder, food addiction, and emotional eating using the 5 levels of recovery. And we'll start with the first level, which is how you can stop unwanted behaviors. So please join us for the next podcast. Be sure and give us a rating and share this podcast with anyone that you feel might benefit from it. Thank you for listening. This is Dr. Carolyn signing off.